So today I wanted to talk to you about acne treatment. I wanted to talk to you about antibiotics versus supplements versus everything in between and what's really right for you. There are antibiotics, there are prescription medications, there are over-the-counter medications, there are so many different things that can be extremely confusing. And today I'm going to specifically address internal medications or oral medications and also supplements. Now, antibiotics are normally what are prescribed by doctors. There are other things prescribed by doctors for acne that are not antibiotics. And I just want to say this is not meant to be medical advice. This is just stuff that I know that I've asked people, I've talked to doctors about, I have myself have experienced, and just kind of give you pretty much the lowdown from the way that I see it. I'm specifically going to talk about antibiotics and then herbal supplements, or kind of combinations of ingredients or herbs. And there's actually a category in the middle of those two that a lot of people don't know about, and those are called Botanical Therapeutics. And I'm going to kind of explain the difference between those three, give you the pros and cons of each, and hopefully help you figure out what's best for you and your skin. So first we'll talk about antibiotics, because those are kind of, when you go to the doctor, what they prescribe. And antibiotics are used for other things too, if you have infections in the body or things like that. The antibiotics for acne, the most common is tetracycline, also minocycline and doxycycline, which are in the same family, but they're slightly different. And I've listed a lot of the pros and cons for you. And some of the pros is that if you have insurance, it can be very inexpensive. I was taking tetracycline, and the pills for I think 60 pills was only $5, which is very inexpensive, and I would only have to take 2 pills a day. There are many different strains of antibiotics. Some people do become immune to antibiotics. For instance, someone who has like infections or staph infections and things like that. But the good thing is that there are different strains, so that if you get immune to tetracycline, you can switch to doxycycline or minocycline or vice versa. One of the best things about antibiotics is that they do help to treat acne and inflammation. What they do is that they go into the body and they target bacteria. Now, unfortunately, and this is a con, is that they kill the good bacteria as well as the bad bacteria. So they're killing the bacteria of the acne, but they're also killing good bacteria. But one of the good things is that they are very anti-inflammatory. So if you have cystic acne, mine was really bad right here, very inflamed, very itchy, it does help to decrease that in most people. Everyone's different, and if you have an allergic reaction to it, then that's not the same, but talk to your dermatologist. But it can help to decrease that inflammation. That does normally help with a lot of people's cysts and things like that. Generally, antibiotics are more effective than topical treatments like creams or cleansers because it is going on the inside and killing the bacteria. But now we'll get to the cons of antibiotics, and one of the biggest cons is that when it goes in to kill that bacteria, it's killing the P. acne bacteria. Acne is caused by P. acnes bacteria. It's killing that, but it's also killing all the good bacteria. I'm sure that you've heard of intestinal bowel flora or good bacteria in, things like yogurt or sauerkraut or apple cider vinegar, or pickles or things like that. And the bacteria is really happy in our gut, but the problem is that when people take antibiotics, it kills out a lot of that bacteria, and once you stop taking the antibiotics, a lot of times the bad bacteria will grow out of control because the good bacteria has been kind of killed off. Another con is that you can become immune to them. For instance, if you've been taking antibiotics for acne all these years and then all of a sudden you get a staph infection such as MRSA, which can be very deadly, a lot of people become immune to antibiotics, and then when they get these infections, they don't have anything that can fight them off, which can be very dangerous. And that doesn't happen all the time. It is relatively rare, but in those cases it can be very dangerous. Another con is that without medical insurance, antibiotics can be extremely expensive. Even though my tetracycline was $5 with insurance, without, I think the same bottle was like $350. And that was for the generic version. Another con is that they're not as easy to get. You do have to talk to a doctor or a, what would that be, a dermatologist or a nurse practitioner, or someone who's able to prescribe you those medications in order to get that medication. You can't just buy it over the counter. They can also cause yellowing of the teeth and sensitivity to light. For me, that was a big problem. I would sunburn all the time, and they are photosensitive, so they actually thin out your skin. Another big con is that they are not really natural, and they come from different sources even though they're the same kind of medication. You can get generic, you can get an actual brand name, but honestly some of those can be toxic or have toxic ingredients within them, so it's not the most natural route. For me, I tried them. I was on them for years. I did find that once I stopped them, in about 6 months, my acne did come back worse. That's just me. They made me very sick in the morning. I would throw up almost every day because you take them on an empty stomach or with a little bit of food, and I just could not handle them. So that right there should have been a hint that I should not be taking them. They did help my acne temporarily while I was on them, but they made it worse when I was done. So there are supplements as well, which are the kind of over-the-counter things that really are regulated, but they're not really. But I'm going to talk to you about a little class in between that a lot of people don't know about, and those are called Botanical Therapeutics. Now, this is underneath an antibiotic because you don't need a doctor to prescribe them, but they're above just kind of regular supplements. And the reason why is because regular supplements don't really have like they don't really have a standard. You can call it natural, you can call it a supplement, but it's not regulated by the FDA or anything like that. Botanical Therapeutics are different because they're kind of like a higher grade supplement. They have proven ingredients, they've done clinical testing or clinical studies, and they're kind of like basically medications. The only difference is that they're made with natural or botanical ingredients instead of lab-made chemicals. The biggest pros of Botanical Therapeutics is that they normally are plant and herb derived, and they're very, very natural. As compared to, antibiotics or other prescriptions, they are generally more safe. Your body can still have reactions to them, and I would definitely talk to a doctor. The other great thing is that they have been around for centuries. I mean, if you look back in the history of medicine and things like that, people like Hippocrates, the Egyptians, the Romans, all of these people have been using food and herbs and supplements as medicine. And it's taking those principles and putting them into concentrated modern day ways of getting those. And another really good pro is that you don't need a doctor to prescribe them. Now, one of the problems is that they can be expensive. Normally, insurance does not cover these kind of things. You have to find them at a discount or just pay a different price for them. Some of them are cheaper, some of them are more expensive. Another con is that they can react with other prescription medications, which is why you should talk to a doctor. Just because if you are taking like an antidepressant medication, and if you take something like St. John's wort or St. John's root, which is really good to help you fall asleep, they can actually counterbalance those depression medications. So just be a little bit careful. And just like with antibiotics, I have had experience with Botanical Therapeutics. I was on Botanical Therapeutics for almost 2 years, and I still take them every now and again. The ones that I specifically used are Acne Ease, and they are a tablet that is botanically derived. They're made from plants, they're made from herbs and minerals, works from the inside. Botanical Therapeutics can be used for many different things, such as anything from pain to weight management to whatever. But particularly in the acne space, this one claims that it treats acne from the inside and actually stops the cysts from forming. On their website, it says a lot of users claim to see results after 1 week. For me, it took a little bit longer. When I started using this originally like 2 years ago, my acne was terrible. And it took me about 4 weeks, 5 weeks to even see a difference. Everyone's skin is different. This is something that reacted well to mine, but they do have different dosage plans. For me, I took the severe dosage plan. They have plans for men and for women, for athletes and for non-athletes, for people who have an occasional period breakout, versus for people kind of like me who had it really all over my face, chest, and back. And you're supposed to take them at different times throughout the day. And that is one of the cons of this particular Botanical Therapeutic, is that it's a lot of pills to be taking. And for me, I was on a maintenance phase for like ever, which means I would only take maybe 1 or 2 a day, whereas in the beginning I was taking 10 to 15. The good thing is that once you kind of go through that detox phase, you don't need to keep it that high level. Once it's treating the acne from the inside and kind of taking on it head on, you can kind of lower the dosage amount. The biggest thing to remember with Botanical Therapeutics as well as regular medication is that there is no one quick fix for acne. You have to take things slowly. You have to try it for, whether it's a botanical therapeutic or an antibiotic or anything else, you should try it for a good 4 months or 6 months to really see how it reacts with your body and your skin. Just because you can have daily changes, hormonal changes, sleep changes that can cause things, and you'll be like, oh my god, I'm using this new antibiotic and it's breaking me out so bad and it's terrible. When it could be that you just got no sleep and ate a bunch of ice cream and even had your period for a couple days and that caused your breakout. And when it comes to supplements, supplements are very widely known. They're what you kind of find over the counter, and there are a lot of pros and cons. The good thing is that, again, they are more natural. They're normally at a health food store or things like that. They don't normally have a lot of chemicals or a lot of toxins. Now, it does depend on what you get, because there are some that are truly herbal supplements that don't contain toxins, and then there are others that are saying, we're herbal or we contain whatever, but when you look at the ingredients, there's a bunch of crapola in there. So you do have to be a little bit careful. Another thing is that there's usually a lack of dosage instructions. I know that a lot of herbal supplements say like, oh, take 3 pills once before every meal or whatever. But you know, obviously a 6'2", 250-pound athlete male who has acne is going to need a different dosage than a 5'2" petite girl who, you know, doesn't do much exercise. They're going to need 2 very different treatment systems. And the good thing about, you know, prescription medications and botanical therapeutics is that they take that into account, whereas over-the-counter supplements, it's really just, oh, take 3 times a day or take once a day, which is not ideal for every body type and every lifestyle. One good thing about herbal supplements is that they usually treat more of the cause than just kind of getting rid of acne. For instance, with antibiotics, it just kills the bacteria and it doesn't really treat the root cause of the acne, which could be hormones or stress issues or allergies, whereas botanical supplements, depending on what is causing the acne, let's say that you have a hormone imbalance, or let's say that you're really low in zinc or iron, if you take a supplement with the zinc and the iron and stuff like that, it can help balance those things out and actually treat the acne from the root cause. The difficult thing is that you don't know what that root cause is because there's so many of them, and you know, you might not always get the right supplement for your need. Another pro is that you don't need a doctor to prescribe them, and another thing is that they can have good results for your entire body. For instance, if you're eating something, a supplement that is meant for your skin, a lot of times it's also going to be very beneficial to your nails and to your hair, and so you can get the great benefits of great nails and great hair is included with kind of the supplement for your skin depending on what's in that supplement. Another con is that they can be very expensive and that there really is no regulation. There are high quality herbal supplements and very low quality herbal supplements. The low quality ones, like I said, are just crap in a bottle that they claim is natural, like bleach can be natural, arsenic is natural, lead is natural, but that doesn't mean it's good for you. So if you are going to go the supplement route, make sure you look for something that is a higher quality and that just has more pure ingredients, but that's hard to tell because there is no real guideline that's kind of set in place for them, because they are not regulated by the FDA. But that's kind of the lowdown. Like I said, I've tried antibiotics. They did not really do much for me. I have tried herbal supplements and I like them a lot. The only problem is that I have personally found it's hard for me to know what's right for me, and I like herbal supplements better for things like hair, or better for things like when I catch a cold or when I have the flu, or you know, specific needs like that rather than acne. I have tried Botanical Therapeutics. For me, that is what has worked best. But these are a lot of the pros and a lot of the cons of all of them. I know it's a lot of information, but I really hope that this helps you guys, you know, if you have acne, to make a really informed decision about what is right for you. So let's have a talk about it and try to figure out the answers to our questions. So I love you guys, and I cannot wait to talk to you all soon. Love you guys. Bye.